The reproductive system is often discussed only in terms of sex or having children, but it is much wider than that. It is a living network of organs, hormones, blood flow, nerves, and changing tissues. It influences fertility, menstrual cycles, sexual function, pregnancy, birth, and the physical transitions that happen throughout life. In women, the reproductive system includes the ovaries, fallopian tubes, uterus, cervix, vagina, and vulva. The ovaries mature and release eggs and produce hormones that help coordinate the menstrual cycle. The uterus prepares a lining that could support a pregnancy. If pregnancy does not occur, that lining is released as menstruation. This is not the body failing. It is a planned cycle of preparation, release, and renewal. The menstrual cycle is not controlled by the ovaries alone. The brain, pituitary gland, ovaries, and uterus communicate continuously. Hormonal signals change across the month, guiding follicle development, ovulation, and the preparation of the uterine lining. This is why menstrual health reflects more than one organ. Sleep, stress, energy intake, illness, age, and major changes in exercise can all influence the rhythm. A late or missed period does not automatically mean something is seriously wrong, but repeated changes are information worth investigating rather than simply suppressing. In men, the reproductive system includes the testes, epididymis, sperm ducts, prostate, penis, and associated glands. The testes produce sperm and testosterone under signals from the brain and pituitary gland. Sperm production continues after puberty, but it is sensitive to the conditions surrounding the body. Heat, illness, poor sleep, alcohol, smoking, some chemicals, and long periods of stress can all affect reproductive function. Once again, the reproductive organs do not work alone. They depend on the endocrine system for hormonal communication. They depend on the circulatory system for oxygen and nutrients. They depend on the nervous system for sensation and function. They depend on the liver and kidneys to process and remove substances from the blood. And they depend on adequate energy. When the body is underfed, exhausted, or continually threatened, reproductive processes may be reduced because immediate survival takes priority. That can appear as irregular periods, loss of libido, reduced sperm production, or difficulty conceiving. These changes are not proof of one single cause. They are signs that the whole picture needs to be considered. Stress has a strong influence. The body cannot always separate emotional pressure from physical danger. When stress remains high, sleep may worsen, digestion may change, and hormonal signals can become less stable. Trying to force one reproductive symptom into submission without addressing the wider strain can miss the reason it appeared. Age brings natural changes too. Puberty activates reproductive function. Pregnancy creates major temporary adaptations. Perimenopause is the transition leading towards menopause, when menstrual cycles finally stop. Menopause is not a disease. It is a normal life stage, although symptoms can still be difficult and deserve support. Male reproductive function also changes with age, even though there is no single equivalent event. The aim is not to pretend that age has no effect. It is to separate natural change from avoidable strain. Supporting the reproductive system begins with the basics: enough food and energy, regular sleep, natural movement without constant exhaustion, time outdoors, a calmer nervous system. Simple meals based around fresh, minimally processed food, less alcohol, smoking, and unnecessary chemical exposure, and enough recovery between periods of physical or emotional demand. The reproductive system also deserves direct attention. Persistent pelvic pain, very heavy bleeding, bleeding after menopause, unusual discharge, a new testicular lump, sudden testicular pain, or continuing difficulty with sexual function should be properly assessed. These symptoms should not be dismissed as detoxification or something to push through. Sexual health testing also matters because some conditions can be present without obvious symptoms. The reproductive system is not separate from the rest of you. It reflects hormonal communication, circulation, nervous system balance, energy availability, and the stage of life you are moving through. It carries the possibility of creating new life. But even when someone never wants children, the system still influences their health, rhythm, and well-being. From the natural body intelligence perspective, the message is simple. Do not reduce the reproductive system to one organ, one hormone, or one symptom. Look at the conditions surrounding the whole person. The body is always communicating. When we listen early, support the basics, and investigate genuine warning signs, we give this system the best conditions in which to carry out its work.